An extremely common question I get is, what about cardiac health? What about saturated fats? Aren't they bad for us? Isn't that risking a heart attack or stroke having all of this saturated fat in our diet? And I brought someone today to join us to answer these questions. Everybody, I want you to introduce you to Dr. Ovadia. For those who have not been exposed to him, I actually, funny enough, have his book that I read sitting next to me. It's been an excellent read. Thank you so much for joining us.
Great to be here with you, Amanda. Really excited to talk with you and your community.
Absolutely. To start off, I really would just like, because I've read your stuff, I've watched a lot of your YouTube videos and things like that. But for those that haven't seen or been exposed to you, can you just do like a quick synopsis of your story?
Sure thing. So I have been a heart surgeon for over 20 years. And for much of that time, I was a very unhealthy heart surgeon. I had reached a point where I was morbidly obese. I was pre-diabetic. And I kind of realized that I was going to end up on my own operating table, so to speak. I was following that same path that so many of my patients follow. And like so many of them, I really didn't know what to do about it because I was following the advice that I had learned to give. I was eating less, I was moving more, I was eating according to the food pyramid and a low-fat diet and all of that stuff. And while I had had some short-term successes, I'd lose some weight, I'd inevitably gain it back and more. Thankfully, I started, asking some different questions, thinking about some different information, getting exposed to different information. And I was able to reverse, to change my course. And I was able to lose 100 pounds and reverse my pre-diabetes and my insulin resistance. And I have now been able to maintain that for, going on 7 years now, really coming up on 8 years. So I had found success. And what that opened my eyes to was how we had gotten so much of this wrong, meaning the medical establishment, how heart disease, the disease that I had dedicated my entire career to treating, we misunderstood what caused it. And if we misunderstand what causes it, that's going to lead us to try things that aren't going to work to, overcome it. So in the last few years, I've kind of refocused my career. I continue to work as a heart surgeon, but I became increasingly interested in how to prevent heart disease and how to keep people off my operating table. And so that's what led to me writing the book and everything that I do now to try and educate people as to how they can avoid heart disease and stay off of my operating table.
So you're still actively a heart surgeon, something you do day in and day out pretty much now still?
Yep.
Have you seen for your patients that you see, because I know with heart disease, it's not you can stop it 10 days before it happens kind of thing, but for your patients, have you noticed improvements in your way you educate them now, even after they have to have surgery and things like that?
Yeah, exactly. So, when patients come to me as a heart surgeon, for the most part, they're already at the advanced stages. And you're right, usually there isn't really that opportunity to change that right away. But what the conversation that I'm now able to have with them is that the surgery that I'm doing is not going to change the underlying problem. It does not address why you got here in the first place. And if we don't address that, you're going to have continued problems with heart disease. And again, this is what our experience tells us. Most patients that undergo heart surgery, and again, we're focusing here on what we call atherosclerotic heart disease, plaque building up in your arteries, which is the most common reason that people undergo heart surgery. The people who undergo that surgery, for the most part, they still end up dying of heart disease. Now, you relieve their symptoms, you extend their life, you make them feel better. But because the surgery doesn't address the underlying problem, it continues to be a problem in their life, and they may need further things done down the line. So now I have that conversation with them, and I talk to them about We're going to do the surgery, which deals with the problem that's in front of us, but we also need to address the underlying reason why you got here in the first place. And that I've seen great success with. And in the people who do get to me earlier, for instance, the people that, I work with now in my telemedicine practice on preventative health, we are seeing great success in those people. They are stopping the progression of their heart disease. And in some cases, they're showing evidence of reversal of their heart disease because we are addressing the underlying root cause of the heart disease.
Yeah, that's amazing. My PCP that I have right now, it was a rough go in the beginning because when I told him I was doing carnivore, he kind of, eye roll, but I'll keep seeing you. Surprisingly, he sent me to a cardiologist, even though I don't have any cardiac issues because my cholesterol was elevated. And I actually was somehow lucked into the cardiologist as Carnivore / just like whole food diet. And so he was all about it. But that does kind of take me into like the main topic I want to talk about, which is cholesterol, LDL cholesterol, and the risk of cardiac events doing things like low carb, keto type diets.
Yeah, so, a very big question and still a lot of unanswered components to that question, to be honest. But, what we can look at and what I like to look at is, first of all, when we go back and we look at what are the true risk factors for heart disease, what we see consistently in every study that has looked at this is that if you look at insulin resistance and if you look at elevated cholesterol levels, insulin resistance is a much bigger risk factor for the development of heart disease than elevated cholesterol levels are. One study, more recently, the Women's Health Initiative study, this data was published, I believe, in 2021, and they looked at exactly that question. And the risk associated with having an elevated LDL cholesterol level was 1.4, meaning that, 1.4 times the risk of developing heart disease if you had elevated LDL cholesterol compared to if you didn't. Then they looked at what's called LPIR, the lipoprotein insulin resistance test, another blood test, that reflects your level of insulin sensitivity. And if you had
is that the same as like the fasting, just for clarification, fasting insulin test would be that one?
No, so this is a more advanced way to look, and what LPIR does is it actually looks at the sizes of your cholesterol particles and uses that to determine how insulin resistant you are. And so when you look at the LPIR test, having an elevated LPIR puts your risk of heart disease at 6x the baseline. So
wow.
6x versus 1.4x. So anything that's going to address insulin resistance is going to be much more powerful at reducing your risk for heart disease than things that reduce your LDL cholesterol. And so that's what I choose to focus on. Now, the question of whether LDL cholesterol being elevated in the context of being insulin sensitive, in the context of being metabolically healthy, whether that actually increases your risk for heart disease at all, that's an unanswered question. We have some data that would suggest that it may not be. We have some ongoing studies that are trying to look at that question. But, that's the question that comes up so often for people who are doing ketogenic carnivore diets. They reverse their insulin resistance, they reverse their diabetes, everything looks great except their LDL cholesterol level goes up. And this causes their doctors a lot of concern, but it's not clear that there's any reason that we need to be concerned about that elevation in LDL cholesterol. So it's a very complex issue, and it's a lot of what I spend my time working with patients on to help them understand and to help us, make that decision for people, as to whether or not to continue these diets, whether or not to do, other things to try and lower their cholesterol levels. Very, as I said, very complex issue. we don't have all the answers, but what I do know is if you're improving your insulin resistance, you are significantly lowering your risk of heart disease.
So if I came to you as a patient and I said, okay, I'm doing carnivore, so far I've lost close to 120 pounds. My triglycerides went from like 350 to like 100. My insulin resistance has improved. But you saw that my LDL was around 150. Would you be concerned for me at all?
Yeah, most likely not. There are going to be some other, things that I'm going to want to know. So, it's one thing to know the amount of cholesterol in your bloodstream, which is what the standard lipid panel tells you, the LDL-C number, as you'll see. It's another thing to know the quality of your cholesterol. And this is where we start getting into things like particle sizes, the advanced lipid testing. This is where we're going to get into things like oxidized LDL levels, because that's another part, and I think a more important part of understanding whether or not having too much cholesterol is a problem. And basically what I tell people is if you have a lot of good quality cholesterol, it's not going to be a problem. If you have a lot, or even if you have a small amount of bad quality cholesterol, that may be a problem. So one of the things I have observed throughout my career as a heart surgeon now, 20 years, is that there are plenty of people who end up on my operating table with what is considered a normal or low LDL cholesterol level. And I started wondering, why this might be. If it's all about lowering your cholesterol, then we shouldn't be seeing so many people with low normal LDL cholesterol levels that still end up with advanced heart disease. And this is where I think we are looking at the wrong question. We're looking at the amount of cholesterol when we should be looking at quality of cholesterol. And it turns out that probably the main determinant of the quality of your cholesterol is whether or not you're insulin sensitive. So it all leads back to the same place, all different ways of looking at it. But when someone comes to me with that scenario, very common, that's where we need to dig in a little deeper. We need to see what type of cholesterol you have. The other thing I want to know in someone like that is, okay, do you have any evidence of heart disease or not? And again, we have a very, good test to determine that these days. It's called a coronary artery calcium scan. It's a simple CAT scan. They don't have to put an IV in you. Literally takes 5 minutes to do the test. And in most places here in the US, it's relatively inexpensive, under $200, oftentimes under $100 to get that test done.
Wow. And that's if you pay out of pocket?
That's paying out of pocket because insurance usually won't cover this test for reasons that, we can maybe discuss. But you pay out of pocket, you get the test done, and it will show you whether or not you have disease in your arteries. And that is another very important piece of information, because if you do not have any evidence of disease in your arteries, then probably your cholesterol isn't an issue. Now, there's some factoring in of how young you are. The younger you are, the less of a sort of guarantee that test becomes, but it's still very useful information. And so that's another piece of the puzzle that I oftentimes advocate for people to have that test, because ultimately we don't really care about cholesterol. We care about heart disease. So let's measure heart disease when we can.
That's an excellent way of saying it versus just focusing on one very narrow metric that may or may not be impacting it. About the insulin test. So how accurate, just like the basic fasting insulin that like most PCPs do versus the advanced fasting test? I mean, is it even worth doing the basic one?
Yeah. So first of all, so the fasting insulin level is a great test. And I think it is a test that everyone should be doing. You said that most PCPs do. The reality is that most PCPs don't do anything around insulin.
That's a good point. Is most don't, because I had to ask mine to do.
Yeah, no, you usually have to ask, and even when you ask, a lot of them are going to push back because they don't understand it. They don't understand what the relevance of it is. But a fasting insulin level is a very powerful test. And it's going to show you, if your fasting insulin level is elevated, that means that you're insulin resistant. If your fasting insulin level is normal, you still might be insulin resistant, but there's a much better chance that you're not. And, so that's why I don't think fasting insulin alone is enough. And there are some advanced, things that we want to look at, but it's at least a start, and it's going to give you a sense about whether or not, you're on the right track.
Got it. And I know, because I've been rereading your book, that you're talking kind of about like type 2 diabetes. So the insulin resistance, it ties into it. Do you feel like the A1C plus the insulin, the fasting insulin, is just like a good metric of kind of a gross view of the metabolic health?
Yeah, so those two combined are going to give you a pretty good idea of your metabolic health. Understand that insulin, that type 2 diabetes is just the end effect of insulin resistance. It's what happens when you have been insulin resistant long enough. Now, the A1C, again, may be a delayed indicator of problems as well. There is a significant period of time that people usually go through where their A1C is going to remain normal, their glucose is going to remain normal, but their insulin level is elevated. And basically what that means is that your body is working extra hard to keep your blood sugar level under control. This is why the fasting insulin test is so powerful, because you can see these problems developing way before you get to the point of your A1C and your glucose is elevated. And most doctors, only check the glucose and the A1C, so they only see the end effect, and they miss all the warning signs that the problems are developing. Other warning signs, other simple warning signs we can look at, by the way, come from your lipid panel, but it's not your LDL cholesterol level. It's your triglycerides and your HDL cholesterol. And specifically, you can look at the ratio between those two. And if your triglycerides divided by your HDL is more than 2, that ratio, that's another indicator that you may be insulin resistant. And that's something that should be investigated further.
What is an ideal for the ratio? I mean, if you could say you're super healthy, you need to be here, what would be the ideal for the ratio?
Yeah, so I think ideal is less than 1.
Okay.
I think anything under 1.5 is probably just fine. And anything over 2 is a warning sign. It needs to be investigated further, but there's a good likelihood that you're insulin resistant if your ratio is over 2. One important note, I don't know how much of an international audience you have, but you need to do that ratio in US units. It needs to be milligrams per deciliter for both the triglycerides and the HDL. If you're working in, millimoles, because the conversions are different, the ratio is different. So convert to milligrams per deciliter and then do the ratio if you're looking at your results in millimole.
That's perfect, because people ask me a lot of times, and they are doing the non-US units, and I'm like, I don't know what the ratio ranges are, because the numbers are completely different in how they get done. Before I started my journey, I had all of this done, and I believe my ratio, I was like 8.3.
Mm-hmm.
And 3 months ago, I believe I had it checked, and I was like 2.2. And I actually go again in 2 weeks to have, because the cardiologist that I see is doing the advanced cardiac panel. So we'll see then. And that's a huge change, because 11 months will be for me. I've been on Carnivore 11 months next week. So that's a big change.
Yeah,
Big
no,
improvement.
that's excellent progress. And, and that's something that people need to understand as well, that, you can't, these things don't change overnight. It took us however many years to get obese, to get insulin resistant, and it takes time to undo that.
Yes.
But all you can do is improve from where you are. And that's exactly the goal you should have. And I love seeing numbers like yours. And I see them all the time with my patients now, because we have the tools that we can give them to improve. And people, see the improvements and they feel better and they, look better and they're losing the weight and they have more energy. And so they want to keep doing it, as opposed to in the past, when I would be giving advice like, eat less, move more, and people would feel miserable doing that. And they, maybe could, power their way through and use the willpower to do it for a few months, but they couldn't sustain it long term. I couldn't sustain it long term. And ultimately that advice would fail. And it turns out that advice was making all of this stuff worse, which, really has gotten us to the situation that we're in today, that metabolic disease is epidemic in our society.
Yeah, I think the last statistic I heard was over 32 million Americans are considered morbidly obese, not even obese, but morbidly obese. And I'm like right at the bottom of it, but I was 300, I don't know how much you know about my journey, but I was 360 pounds at 32 years old, having to use a walker. And what makes it even worse is I work in the medical field for physical therapy. And the fact that I was treating patients like this, and then here I was at 32 in such a shape that I had lost my mobility. It can affect even those of us that work in the healthcare field.
Yeah, exactly. And as I said, I was a morbidly obese pre-diabetic heart surgeon, so it's certainly us in the medical field are in no ways immune to this. In a lot of ways, we're more prone to it because of the environment we work in, the stresses, the food environment in the hospitals, which is just, quite frankly, horrifying to me anymore. And it all, adds up that when you look at health professionals, they're no more healthy than the general public. And a lot of studies would suggest that they have worse health than the general public. So when we step back and say, how could that be? How could the people that are in the healthcare system be less healthy? And we really have to look at, the healthcare system and understand that it is not designed to keep people healthy. It is designed to take care of sick people. And so that's what our focus is. And that is not, the same thing as keeping people healthy in the first place.
Yeah. I mean, it sadly has turned into it's all about the business and the money. And it has slowly eroded what healthcare used to be, 50, 60, 70 years ago. I feel like it's just slowly eroded into, it's just this, we call them, I mean, this revolving door patients, just in, out, in, out. And it's the same person just cycling through because nothing ever actually gets addressed.
Yeah, unfortunately, quite true, and something I see quite often. And like I said, when you look at, what I have spent my career treating, heart disease, again, what I now realize is that heart disease is just the end result of a process that starts long before the heart disease becomes apparent. And the better that we can get at diagnosing that problem early, that gives us the opportunity to intervene and to stop it from getting to the point of heart disease and diabetes and Alzheimer's disease and many forms of cancer and all of these other chronic medical conditions that we suffer from, that all come from the same root cause. And that root cause is insulin resistance. So I now, am aware that if we diagnose and we intervene, based on insulin resistance, we can have major impacts on people's health, and we can stop much of the chronic disease that we suffer so much from today.
Yeah. So a lot of people, they want to start these health journeys and they'll ask, like, what metrics or what things do you think are excellent to track through their journey?
Yeah. So, ultimately, I default back to the 5 basic measures of metabolic health. I think if you are focused on these 5 things, it's going to lead you in the right direction. Now, there are, of course, more advanced things that, we should and do look at, but start with the basics. So the 5 basic indicators of metabolic health are your waist circumference, your blood pressure, your fasting glucose level, your HDL cholesterol level, and your triglycerides. And if you start with those 5 and you get them into optimal range, and if anyone needs to know what optimal range is, it's in my book, or just go to my website, ifixhearts.com, right on the front page, free quiz that will show you whether or not you're metabolically healthy based on those 5 metrics. But those 5 metrics are where I start people, because if you're improving those things and if you're getting those into a healthy range, the other stuff is going to be coming along with it. We can do the measurements to look at the other stuff. And, I think a lot of times that is helpful, but you don't need to. If you just get those 5 things right, you're going to be just fine, and you're going to be metabolically healthy, and you're going to be at low risk of developing all these things that we've been talking about.
Awesome. I want to talk about, I found it really interesting when you were talking in the book about our dietary intake of cholesterol has actually very little to do with our actual cholesterol levels in our body.
Yep. Yeah. So this is a common, misconception. And honestly, it's a common misconception amongst amongst doctors and other healthcare professionals. It turns out that, the amount of cholesterol that we eat and the amount of saturated fat that we eat, 2 things that we have been told are bad for us because they raise our cholesterol levels, that association is very inconsistent at best when you look at the scientific literature. And the amount of dietary cholesterol has very little influence, if any, on your blood cholesterol levels. Understand that cholesterol is a substance that your body makes. Your body recycles and traffics. So, cholesterol is going through your bloodstream. It's going to all the cells of your body because it is an essential substance that we need to survive. And it's being moved all around your body. And then it comes back to the liver and it gets reprocessed and repackaged and it gets sent back out again. The cholesterol that we're absorbing through the intestines from our diet ends up having very little effect on our blood cholesterol levels. So, there are the diet heart hypothesis, as it's called, which is the prevailing hypothesis about what causes heart disease, has 2 parts to it. The first part is that, the dietary cholesterol that we eat increases our blood cholesterol levels, and those increased blood cholesterol levels then lead to heart disease. And it turns out that both parts of that hypothesis, are not true. We have plenty of evidence that contradicts both sides of that hypothesis. And again, this has been our focus for 50 plus years when it comes to heart disease. And we have not seen a meaningful impact on the incidence of heart disease with that focus. So that's one of the other kind of high level pieces of information that caused me to step back and say, what's going on here? What are we missing?
Oh, well, yeah. I mean, why do you think that despite having this hypothesis to the most degree debunked, that it continues to just be so prevalent in the medical community?
Yeah, well, first of all, understand that it hasn't been debunked for the mainstream medical community. The information that I see talked about, in the metabolic health community is not the same information that is getting to most doctors. And, most doctors, when they're going to medical meetings like the American Heart Association meeting, or, they're getting the guidelines that are written by the societies that we practice under, are not incorporating this information. This information simply isn't presented. What has been the prevailing information that is presented is the information that supports their hypothesis, this diet heart hypothesis. And yeah, there is some information that, can support that if you sort of look at it in the right way and you don't ask questions about it. It can be made to look like this is the hypothesis. And now we're at a point where 50 plus years into this, there's very powerful forces that are invested in this hypothesis. And we can't deny that this plays a role as well. Obviously, the pharmaceutical industry is very heavily invested in this hypothesis. The food industry is very heavily invested in this hypothesis. And quite frankly, the healthcare system is very invested in this hypothesis. And so it becomes difficult for large institutions like that who have been talking about these things for so long to step back and say, oh, we might have gotten it wrong. And I don't believe that it was like an intentional misdirection. I mean, there was bad science, there was fraudulent science that went into this. But, I don't think it was that someone, or some entity set out to say, well, we're just going to mislead everyone about this. It was a valid hypothesis at the time that it was first proposed. And then there was science that was put forward that seemed to support the hypothesis. And things just got moving, down this, in this direction. And by the time we, kind of figured out what was going on, it was too late to change the direction, and so that's where we find ourselves today. But I think we're finally at the point where enough people are saying what's going on here. Enough people are saying, why is heart disease still the #1 killer, despite the fact that we have been so focused on heart disease for the last 70 years?
Yeah, I remember reading one of the older studies from, I don't remember which one it was, but it was about LDL, and they completely eliminated cohorts that had elevated LDL but lived longer. And they even wrote, like, 'cause you have to actually read the study, not the meta studies. And I just remember thinking, good Lord, they're completely eliminating this because it doesn't support their hypothesis. But there was no reason to take it out other than it didn't meet what their hypothesis was trying to say. And, this is one of the fundamental studies that's based on LDL is bad. So,
Yeah.
and I think that, go ahead.
No, I was going to say, unfortunately, that's something that it tends to happen in medicine. We tend to grab hold of these ideas, and we tend to ignore the information that might contradict it. All too often in medicine, we want to say that, someone who doesn't fit the narrative is just an outlier, and they must have some unusual, thing about them that we can't understand. But we still, for the population at large, this still holds. And, when we look at the cholesterol story, we kind of see that, we say, okay, on the large scale, when you look at population level cholesterol data, it does have some correlation with heart disease. But that doesn't mean that, on the individual level, everyone with elevated LDL cholesterol, has a problem with heart disease. And it doesn't really help us to, I guess, we can't ignore that when you do things to try and lower people's LDL cholesterol levels or people's total cholesterol levels, there are going to be effects of that. And that those things, there might be some negative effects involved in that as well.
Yeah. Correlation does not equal causation.
Yeah.
That's a big thing. Statistics can be, sadly, you can manipulate them to say what you want them to say by just removing X amount of outliers or what. So, a burning question I did have. I saw you did the video on not needing to do any cardio for cardiac health. And that kind of brings me to HDL. We want to have higher HDL anyways. What are some ways that we can elevate HDL? Because from my understanding, most of the time is you need to exercise to raise it.
Yeah. So, just to kind of clarify about cardio, what I was, saying, and what I continue to say, is that cardio is not effective for weight loss. That doesn't mean that it's unhealthy. That doesn't mean that we shouldn't be doing it. Just understand that, if the primary method you're using to lose weight is cardio, That's not going to work in the long term. Now, in terms of HDL cholesterol, you are right that exercise generally helps to increase HDL cholesterol, but it's actually resistance exercise and building muscle that increases HDL cholesterol, not cardio activities. So if your goal is to raise your HDL cholesterol, your activity should be focused on building and maintaining muscle. And building and maintaining muscle, it turns out, is especially powerful when it comes to your metabolic health overall. Muscle tissue is more metabolically active, and it's going to be more metabolically active throughout the day. You know, even when you're asleep, the more muscle you have, the more, energy that you'll be burning. Muscle is a great place that our body can store sugar without the negative effects that come with storing sugar in fat, and specifically storing it in visceral fat. So the more muscle you have, the more capacity you have to offload some of the glucose load, from that may be coming from your diet. So that is why I like to emphasize building and maintaining muscle and doing resistance exercise.
Do you suggest that for your patients and clients who are, trying to get metabolically healthy, but also trying to lose weight? Do you suggest strength training, in other words, along their journey?
Yeah, definitely. I definitely emphasize resistance training, strength training for improving your metabolic health and, really just for general health. When we look at the data around muscle, it is clear that the more muscle that we maintain as we age, the better our health is going to be and the longer we're going to live. So it helps with both, lifespan and health span when you look at building and maintaining muscle. And, we have studies in lots of different populations to show this, but specifically within the heart disease population, we have very good data about this. So I believe that our focus as we age should be on building and maintaining muscle and avoiding what we call sarcopenia, which is the typical loss of muscle mass as we get older.
Yeah, from a physical therapy point of view, from reading your book, I feel like we're kind of aligned with this view, is that moving more but less in the sense of just doing exercise, but moving throughout the day is much better than I'm going to do, an hour of cardio versus, okay, I'm just going to be active all day long. But from the physical therapy standpoint, maintaining and then gaining muscle, especially later on in life, it is good for the joints, the bones, helping strengthen your tendons, less likely that if you are stronger and mobile, that if you fall at 70, you're going to not break a hip, like these kinds of things. And I don't think people really take into consideration how important, not just for cardiac health, but, and metabolic, is how important having muscle in our body is for just supporting ourselves.
Yeah, very much true. And, and then we can even look deeper and we can see that, reduced rates of Alzheimer's disease, for instance, in people that better maintain muscle as they get older. And you would say, well, why is there a connection between how much muscle you have in your brain health? And that all ties back to metabolic health ultimately and insulin resistance. So we're certainly aligned and on the same page there, that focus on building and maintaining muscle, and that's going to lead you down a good pathway. And then, like you said, the activity part of it really comes down to be more active throughout your day. Find those little bits of activity that you can do throughout the day, and that's going to have a much greater impact than just going to the gym for an hour, doing your cardio, and then sitting around, the rest of your day. That's where we see that cardio really becomes not helpful and not beneficial.
Yeah. If you think about it, if you are up and moving intermittently for, 12 hours a day, let's say, even little bursts, you end up overall being more active than your hour at the gym. And the thing I find too is you get the dopamine from getting things done and from moving and just being about life versus sitting on the couch watching Netflix, but yet you still did go to the gym. So it has, I think, a huge psychological benefit that goes with it.
Yeah,
I'm
I would certainly
curious.
agree. Yep.
I'm curious on your opinion with the Alzheimer's and muscle connection, that do you think part of the improvement is because they have more muscle mass, they are actually able to store glucose more readily in their muscles versus it just free floating and causing all the damage?
Yeah, no, I certainly think that that has everything to do with insulin resistance. And, we know that insulin resistance is the major risk factor for the development of Alzheimer's disease. Many people, many physicians, many authorities refer to Alzheimer's disease as diabetes of the brain or type 3 diabetes. And it's clear that insulin resistance plays a major role in the development of diabetes. So the connection there is certainly the more muscle you have, the less likely you are to become insulin resistant, and therefore the less likely you are to develop things like diabetes, like Alzheimer's disease.
Crazy. I think I don't remember if I read a paper too recently, but it was talking about dementia, like early onset dementia and the impacts of sugar on that. But it's less known because it's, from what I understand, it's not, early onset dementia is not a huge issue at this point in time, compared to just, older aged dementia and things like that.
Well, again, I think a lot of it has to come to that, again, that early recognition of it. And, we've reached a point where things like, forgetfulness are accepted as normal because they have become so common. And so we don't, pay attention to them like we should. But I think it is a major warning sign, if you're starting to become forgetful about things, that is something to be concerned about and to be looking into. And that, again, many of us have experienced how the cognitive improvement, the sort of mental clarity that comes with improving your metabolic health. And, if anyone is kind of out there that has developed these early forgetfulness, early onset dementia, I would strongly encourage you to look at your metabolic health, determine if you're insulin resistant, and take action to improve your insulin sensitivity.
Yeah, ditto. I have one last question for you. I could not find where the page was in the book. Something you said, because I have 3 autoimmune. I have scleroderma, RA, and fibromyalgia.
Mm-hmm.
I had it even actually before I got as heavy as I did. I started pretty young. I was 18 when I started having symptoms. But you said that RA fell under kind of pretty much, I shouldn't say being caused, but being impacted by insulin resistance.
Mm-hmm.
And that is actually because I've seen rheumatologists. I see a rheumatologist. That is not anything anyone has ever discussed with me. That, don't get me wrong, doing carnivore, my RA is like 1,000 times better than what it was, because I was almost debilitated at 32, not being able to use my hands.
Yeah.
But no one ever talked to me about this connection with insulin resistance and autoimmune stuff.
Yeah. And it's amazing, now how often we, hear the stories of people like yourself who you didn't do carnivore necessarily to improve your RA, but it was just kind of a happy side effect, and again, most of these autoimmune conditions seem to have associations with insulin resistance. The other interesting thing is that, most of these autoimmune conditions increase your risk for developing heart disease. So again, you would say, why would rheumatoid arthritis, problems in my joints, increase my risk of developing heart disease? And, we have very clear data showing this. And the reason is, because that inflammation that's occurring in your joints as a result of the autoimmune process, that same inflammation is occurring in your blood vessels. And that's what, ultimately sets off the process that results in heart disease. So when we address the inflammation, and we address the underlying, driver, the insulin resistance and the autoimmune conditions, we see improvements in all of this. And things like that are what make focusing on insulin resistance so powerful, because it really touches every part of your body. And it can have so many different manifestations that we don't necessarily connect. People will come to me because they have high blood pressure, they have heart disease, but they'll go to the rheumatologist, for the RA, or the or the psoriasis, and they'll go to their OB-GYN because they have PCOS and infertility, and you can keep going down and down the list of every specialty that treats insulin resistance. They just don't recognize that they're dealing with insulin resistance because they're not addressing the underlying root cause. They're just treating the end symptoms of that insulin resistance.
You saying this is just kind of like clicking, because I have PCOS. I was 18 years old and had to have my left ovary removed. Like, I was young, didn't quite understand the damage from that, but it's like, just you putting the pieces together, it's just like, wow, it just all falls back to the insulin resistance over the years of, eating the standard American diet and things like that. And how, seeing a rheumatologist, seeing an OB, seeing a cardiologist, like, the fact is every one of them is treating that end symptom. Wow. That's just, I don't know, putting puzzle pieces together that I had never actually clicked together about the impact of it and the damage that it had done and is doing. Well, I'm almost not insulin resistant soon, but wow. That's crazy. For anybody that is struggling right now, like that is stuck on the standard American diet and is wanting to do better, what is one of your main suggestions you have for them?
Yeah. So, the first suggestion I have is really to focus on your overall health, as a system. I talk about it in the book. I say, you want to look at your health as a system, not as a goal. We get too focused on the short-term goals. I want to lose 20 pounds. And we miss the big picture of, I want to be healthy. And what are the habits that I can take up to support my health? That is the question that leads you to long-term success. And so, that's oftentimes where I start with people. If you want to make a meaningful change, you have to know the meaning behind that change. Why are you doing this? And when you can focus on that, that is what I find leads you to the long-term success and getting you to the habits that you need to develop to improve your health.
Awesome. Thank you so much for taking the time out of your day to answer these questions, go over this, and just help encourage. I really appreciate it. I mean, for myself, and I know for everybody watching this, because there is a lot of eat less, move more being told out there even to this day. And so it's really nice to have people like you standing up and expressing that, no, this is not actually how it works. So thank you so much. And guys, everybody, I suggest, no matter if you are low carb, ketovore, or carnivore, I really loved this book. Even with everything I know, I got a lot of good information out of it. And I have to say, I truly appreciate your call to using a system versus a goal. That is something that I spent my entire life, and I know you did before you got where you're at, focusing on the goal versus the system, and focusing that this is a journey. There is no end to it. It's a health journey forever. So thank you.
Yeah, and thank you for everything you're doing, Amanda. I think your story is inspiring to so many people, and we need that. Ultimately, we need hope. We need inspiration, and what so many people just don't have hope when it comes to their health. They're told that there's no other option. It's normal to become unhealthy as you get old, and there's nothing you can do about it. So the more we can do to spread the word to people that there is hope, that you can remain healthy and vibrant, as you get older, that is what is going to change the direction of our health, our societal health.
Agreed. Agreed. Thank you. Thank you so much for taking the time again. And I hope we can talk soon. I will have all of Dr. Ovadia's links and everything in the description below if you guys want to go visit his site. He's got some amazing YouTube videos. I think he just did one last week with Dr. Barry. So, yeah, thank you and have a wonderful evening.